OBI had like 3 branches in the Oklahoma City office, and it's gotten a little bigger now.
So the fact that OBI is now up to the 6th largest nonprofit regional blood center in the United States,
oh my gosh,
is really amazing. So we really rely on our communities and churches and businesses to fill that gap. The need for blood is constant.
Well, today I have Jesse Dersham with OBI, and you're the executive director for Northwest Oklahoma.
Yes.
And we were sharing a little bit, I think it was like 35 years or so ago, OBI had like 3 branches in the Oklahoma City office, and it's gotten a little bigger now.
It has. We've really expanded and grown. And if you know anything about nonprofit blood banking in the United States, that's a really good thing.
Okay.
You're either expanding, growing, acquiring smaller nonprofit blood banks, or you're being acquired. And so the fact that OBI is now up to the 6th largest nonprofit regional blood center in the United States,
oh my gosh,
is really amazing, especially for Oklahoma, for the blood banking industry, and how innovative we've been in really moving that forward in the United States.
Wow. You know, when I was, we used to do the video promotional things and that for OBI, and at that time, the big thing was you got a bus, or you were planning, you were doing a campaign to buy the bus. You didn't even have one yet. And now I understand you have a few more.
Yes, we have about 40, 45 buses now. Some of them aren't working all the time because they're probably some of those older ones.
Yep.
Our last bus that we got a new one, so we have 3 blood mobiles or blood buses in Northwest Oklahoma. And when we just got our most recent one, we were able to donate our oldest bus to a blood center in El Paso, Texas, just to help with their blood banking and kind of being able to help expand what they can do.
That's neat when you're that capable that you can hand off something like that to help others.
It is. So we've grown now. So obviously Oklahoma Blood Institute will always be our roots. It was started in 1977, and our Enid location was the 3rd location after Oklahoma City Lawton, and then they started a location in Enid. Due to doctors in Enid and Northwest Oklahoma who cared about their patients, they didn't want to have to go to Oklahoma City every time they needed a unit of blood for a surgery. So we're really proud that they were able to make that happen. But now OBI's grown, and we actually have Oklahoma. We provide about 98% of all the blood transfusions that happen in hospitals and medical facilities in Oklahoma. That's about 300 hospitals. And then we also serve Arkansas and North Texas and Amarillo. In Amarillo, we acquired Coffee Memorial Blood Center. And so they've kept their local name. It has roots with patients in the area, but they're under the OBI umbrella as well.
Wow. It's, you know, the average person doesn't think about blood until you need it. And when we come back, we're going to talk about the need this time of year. Apparently is a very important time of year for blood donations. Stay tuned. And we're back. December, we're filming this in December, and I understand this is a difficult time for blood donations.
It is. Well, the need for blood is constant. And so during, August to May, we get a large portion of our blood supply from high schools, technology centers, colleges. I know that's when I started donating blood, was in high school, because I got out of class for a couple hours, got to hang out with my friends while also participating in a community service. And so when they take a break, we lose that portion of our blood supply, but the need doesn't stop. So we really rely on our communities and churches and businesses to fill that gap. However, a lot of people, they take PTO around the holidays, or some businesses even close down because they know their production's going to be lower. So all those things play into this part where we just don't have enough coming in, even though that need is remaining constant. Now, when there's high travel days, we might have more car accidents.
Well, and that's what I was
you know.
going to say. With so many people in motion, Thanksgiving, holiday, New Year's, that probably even makes it worse.
Or, they've met their out of pocket on their insurance, so they're going to get that knee surgery that they had put off all year long. And a lot of people don't realize maybe you didn't use blood during your surgery, but before they can even schedule your surgery or start that surgery, they have to have your blood type, your red blood cells in the OR waiting during that surgery.
Oh, really?
So, if somebody has a heart surgery, they didn't use any blood during it, we still had to have 4 units of blood available for that patient on reserve, on hold. So they're still taking blood out of the blood supply, even if they don't receive that blood. And one thing I want to mention is the biggest challenge right now in nonprofit blood banking in the United States is the competition with for-profit plasma centers. So a nonprofit blood center, how we operate is we partner with people who want to voluntarily donate of themselves. That's the only type of blood that can go directly from you, the blood donor, to me, the patient in the hospital. If it's voluntarily donated, cannot be paid for, to go as a blood transfusion, no.
Okay.
And so when people get paid to sell their blood, it can go into a pharmaceutical or a cosmetic or another drug.
So it's not a transfusion product.
It's not a transfusible product. It has to go into a medication and then be put back to the patient. So it does help patients in hospitals in a roundabout way, but not those units of blood in a surgery.
Okay, because that was going to be my question. I know there's a lot of those out there, and I didn't know if that's like competition, but it's not at all, really.
It's competition for just the available pool of blood donors.
I got you.
And
It takes those people out of your pool.
Yes. Okay. And so it takes it out from, when a newborn baby, they cut the cord and they're not producing red blood cells on their own, they can only receive it from that volunteer blood donor who gave their red blood cells. It takes that away. And so because of that, we're always looking for new blood donors. There's no age limit on donating. You can be 95 and still a faithful blood donor. But when those people can't donate because of health or medications, we need those new blood donors to replenish that blood supply.
Right.
And since 2019, Blood Centers of America, we've seen about an 11 to 15% decrease in that young blood donor who's 16 to 25.
Wow.
And so for you and I, and maybe even my children, the blood supply is going to be available, but my children's children or my children when they're grown adults, we may have a very scarce blood supply.
So it's going to take a lot of education to the younger people to understand the need, and
that's what we're focusing on. We really, we go into high schools and we do really science-based presentations about their blood and how it's used for patient care in hospitals. Something exciting that OBI is participating in, and we're one of the first blood centers, is we're doing pre-hospital transfusion care. So we've started partnering with ground ambulance systems in Oklahoma. We've always supplied Metaflight helicopters, with blood. But now we're working with ground ambulance systems, helping them get the equipment they need. And we're supplying them with a unit of O positive red blood cells, a unit of O negative, and warm plasma.
so they carry this in the ambulance.
Yes.
Wow.
So they can carry it in the ambulance and they can start that pre-hospital transfusion care. Within the first 72 hours of the first units in Oklahoma placed on an ambulance, they had a patient saved who would not have made it to the hospital, but because they received that blood volume replacement before they got to the hospital, they made it. And then they had the fighting chance in surgery.
Wow.
And those things can't be replaced by anything other than a volunteer blood donor. And that's really important just to let people know, especially during the holidays. Every nonprofit is asking for help.
Sure.
Whether it's a monetary donation, toys, clothes, coats, blood. We're one that you don't have to write a check, but you do have to roll up your sleeve and give of your time.
And it doesn't take that long. What is an average?
So if you're donating whole blood, that's our simplest, most basic type of blood donation. It's only going to take you about an hour start to finish. So you fill out a health history questionnaire, we do a mini physical, and then the donation period is only 5 to 8 minutes. We want you to stay for about 10 minutes, replenish those calories you just lost before you leave. So it's about an hour.
Thus the cookies.
Yes, the cookies.
Okay, yes.
The cookies, the snacks, the canned Gatorade. That's what we're famous for. Everybody loves canned Gatorade for some reason.
And sometimes you have a t-shirt.
Yes, we always have a t-shirt.
Oh, really? Okay.
And during the holidays, we also have some really great things. You know, right now we're giving away a Butterball coupon. So any grocery store that carries Butterball, you can use this $15 coupon for anything else. So it's essentially just a $15 grocery coupon.
Wow.
Plus the t-shirt. So we want to help our donors, but legally we can't pay them for their blood.
Sure.
Because we want it to go directly from them, directly to that patient in their surgery, you know, in their trauma care, to that newborn baby. And so we follow those FDA guidelines.
And what's the life cycle of blood? If I donated blood, how long is it? What's the shelf life?
Yep, so if you donate red blood cells, they're good for 49 days, and you're eligible to donate again at 56 days. So there's always that week gap where you're not eligible to donate and your blood has either been used or expired. So that's that gap that we have to replenish with those new donors. So we also take other donations. We take plasma. And plasma can be frozen, so it's good for up to a year. And then we take platelets in our center. So our center in Enid or any donor center, that's where you can donate platelets. And platelets is the product that goes directly to cancer patients.
Oh, well, that was going to be my next question is what is that for? So
Platelets are your clotting factor. So if you go get a chemo treatment, that's going to kill off those bad cancer cells, but it also kills off your platelets.
Yep.
That's the fragment part of your blood that basically stops you from bleeding. It clots your blood, it heals cuts. And so when somebody's low on their platelets, they can't stop bleeding or hemorrhaging and they need more blood transfusions.
Right.
So we give them platelets instead of just keep refilling their red blood cells. The platelets can help their own body stop the bleeding. And those take a little longer. They take about 2 to 2.5 hours, and they're only done in our donor center because the machine that we collect them on is very fragile. Platelets also have to be agitated the whole time after donation so they don't start clotting. So they're a really specialized product, but a lot of people, you know, my mom used platelets during her cancer treatment. And so if you know somebody that's been impacted and the scarcity of platelets, you know, at children's hospitals, sometimes there's a line of kids who are waiting to get their platelet transfusion before they can go to chemo. And so all of those things happen behind the scenes that people don't realize. That 1 hour, that 2-3 hours of their time, it's literally providing a Christmas for a child.
So are platelets, I don't know the right term, are they specific, like, you know, blood has multiple types? Is
Yes.
platelets the same?
So we do label it. We obviously label it male, female, blood type, and RH factor, but more people can receive platelets.
Okay.
So
It's not so specific.
it's not as specific as red blood cells.
Okay. Wow. And then I guess the other thing that I didn't realize, I'm coming to conclusions here, is that your centers are also a blood bank where, and that's why they're there, is that if a hospital needs blood quickly, they can, well, you know, St. Mary's in Enid is across the street. You
Yes.
know, they literally can run over there and get it.
Yeah, so we actually have a blood product services department. So if you ever see a van going down the road with our OBI logo on it, that's our BPS. And they work 24 hours a day, 7 days a week, rotating blood to and from hospitals and to and from our lab. So in Oklahoma City is the only accredited lab in the state of Oklahoma. So all blood that's collected goes to that lab first. It gets manufactured into a drug that can be prescribed. And then it comes back to our center, and from there we distribute it to all of our hospitals. So the 16 counties that surround Enid, there's about 12 hospitals and 2 ground ambulance services and 2 Metaflight helicopter services. We supply all of them with their blood. We keep blood in the hospitals, and then we also keep anywhere, depending on our supply, how much we have, we keep 80 to 120 extra units in our center in Enid. Now, Right now, when we're down to a 1 to 2 day blood supply, I only have about 80 units. Wow. But when I have a 3 to 5 day supply, I can have up to 120.
That's kind of scary when you think of...
It really is, because people, if you think about it this way, if they announced on the news today that we only have a 1 day supply of gasoline in the state of Oklahoma, what would happen?
Oh gosh, yeah, the world would end.
There would be lines, right? Lines at the gas stations.
Yep.
However, we only have a 1 day blood supply right now, and there's not lines upon lines at blood drives. And it's a lot because maybe somebody hasn't been personally impacted, but thinking about it, that you can't even have that knee surgery unless we have blood on the shelf. You can't have, that shoulder surgery, or I wouldn't want to have a baby without knowing there was blood in the blood bank for myself after birth, or my child when they're born. And those things can't happen without the blood being present in the hospital.
Wow, that's a lot to think about.
It really is.
So give blood. really
grateful.
Important. Yes.
The number one reason that people don't donate blood is because they just simply haven't been asked. So I want to put the ask out. Everybody that's listening, give blood. Try it one time. If you're 16 or older, you do need to weigh, 125 pounds if you're 16, or 110 if you're 18 or older. If you meet the qualifications, give blood. Try it one time. Maybe it's for you, maybe it's not, but at least you can say, I tried. And that simple act of kindness, it's the most selfless, altruistic thing that somebody can do, literally giving a piece of their body for their neighbor. They may never meet them, they may never hear about it, but somebody's mom, somebody's child, they're getting an extra day because of your donation. So it's a really cool thing.
It's not like giving up a lung or anything like that. It's a much smaller, simpler way to give life.
Yeah.
So.
We do have a really cool program. It's called Thank the Donor. So attached to every unit of blood that's transfused or in a hospital that's provided by OBI is a green heart. And on it, it says thankthedonor.org, or it has a QR code. They can scan that, and the patient or the patient's family, they can take 1 minute and send a photo, a video, or a thank you message. And it goes directly to the person who gave that unit of blood that they're receiving.
Wow.
And so we have had hundreds, thousands of donors receive a thank you from the person who received their blood. And that's been really
cool.
awesome.
That's what I don't know, with all the HIPAA things, if that was
we remove,
possible,
we're kind of the curator. We remove any personal health information, but you can check them out, thankthedonor.org. They also have social media, and you get to read those. And I mean, it's the sweetest pictures. And, it's just saying, my baby was able to live and make it past the first few days of life because of your blood transfusion, or someone that has a chronic bleeding disorder and they receive blood weekly. Those are really cool, because it might be, my son got to go to his middle school dance because he got his weekly transfusion. And so we've been able to follow patients along the last few years, and their mom might take 5 minutes every time and send that thank you.
That's pretty cool. That is really, really cool. What have I missed?
So we have some blood drives coming up.
Okay.
If someone wants to donate, of course, we are out there everywhere. So just out of my office in Enid, we do about 140 mobile blood drives every month. So 140 opportunities in Northwest Oklahoma per month to give blood. Also, our donor center in Enid is open 7 days a week. So always an opportunity. So you can go to obi.org, type in your zip code, and find a blood drive near you. But we have one coming up in Okeen tomorrow. We have some coming up in Kingfisher and Watonga right around the holidays. And those blood drives are planned to be those holiday hero blood drives, because those are partners who've partnered with us since the 70s on blood drives, and they know the great need. So we are really appreciative. I would say Northwest Oklahoma, we have some of the best donors. The national average is about 3% of a population gives blood. 3%.
Wow.
In Northwest Oklahoma, our average is about 6.8%.
Still could be better.
It could be better, but we are double the national average. So I know we're doing something right. We're doing something great in Oklahoma. We're leading in our industry with developing new tests and being able to let populations donate blood that maybe couldn't donate blood in the past. So if you've ever been deferred for donating, please check back with us. Every 6 weeks, we get an update from the FDA. So maybe you traveled recently and last time you traveled there, they said you couldn't donate. You might be able to now. So we encourage people, check back often to see if you can donate. If you've never donated, give it a try one time. Eat and drink well, because you do lose calories and fluids when you donate. And then just really, I want people to realize the amazing thing they're doing and how it's used in hospitals, and how, you know, hospitals couldn't even have surgeries without blood donors. So it's very, very important. And especially around this time, you're giving somebody that Christmas with their family.
That's amazing. And watch the All About Network, all of the All About Network pages, you know, Hennessy, Kingfisher, Enid, Stillwater, all of them. And we always post, you know, when your events are coming.
Yes.
And of course, the sooner we can get that out, the better, so people can plan. And you know, I'm going to start looking at those differently and think, I guess I actually have an hour. I could go do that, and instead of driving by it and, oh yeah, there was a blood drive today.
Yeah.
So,
well, we really appreciate the partnership and your help getting the word out. And yeah, just that one extra reminder, if somebody sees it and says, I can do that, that's something I can try. Bring a photo ID, eat and drink well. We do have snacks if you haven't eaten and drank well. So we will help you fulfill those calories that you need, and you'll get a t-shirt. But I like to think whenever I get to donate, you know, that's 3 people who I can at least say I helped give some extra time with their loved ones.
well, very, very cool. Jesse, thank you so much for filling us in on Oklahoma Blood Institute. And if you haven't give it a try. I've done it. I got a cookie and a t-shirt. And watch the All About Network pages and learn when the next event will be. And stay tuned.
Awesome. Thank you so much.
You bet.